A little screen's going to pop up, just say continue.
Just let me know when you're ready to start.
You can go ahead.
All right. So we're going to be talking about breast cancer awareness. And I know this is a little bit different from us being all together in the same room, and but inshallah, hopefully there's some helpful hints. And then if you guys have any questions, you can either interrupt me or we can wait until the end. So what I want to talk about today, so just kind of going over what is the annual women's exam, what is breast cancer screening, what's involved there, what is a mammogram, and then who should get genetic screening. And so this little image here says 1 in 8 women will be diagnosed with breast cancer in their life. So it's so common and so important that we go over it and kind of share awareness for everyone. So your Well Woman's visit, I just have to touch on this because it's usually when the breast cancer screening takes place for most women. So the insurance companies actually pay for 2 preventative exams for women per year. So men only get 1 exam, but women get 2. And that's because women have their just general adult health exam as well as their gynecological examination, which usually includes the pap smear and mammogram. And depending on, even if you see someone like me, a family practice doctor, you can go for both of those visits if you like, or you can just do it all in one visit if for time's sake that's more convenient for you, or if you already have a primary care that's internal medicine and then an OBGYN, it leaves both of those options available for you as well. And I don't know if a lot of women are aware of that because sometimes it's not very clear. And usually for preventative exams, you don't have a copay. So, and you shouldn't receive a bill for any services as long as you have regular insurance or Medicaid. So in the preventative Well Woman exam, usually we'll determine if you're at an increased risk for any of the cancers, gynecologic cancers, breast cancers, colon cancers, kind of all of them. And then women 21 through 65 should have screening with a pap smear, and then a clinical breast exam by the physician and ordering their mammogram. And we're going to talk about kind of what ages and what interval of screening and all that kind of other stuff. So just kind of touching on this picture a little bit, more than 75% of women 40 to 60 years old are going to have at least one risk factor for heart disease as well. And so during that, that annual Well Woman exam, it's a good time to, get your labs done, get your cholesterol panel checked, and check for diabetes if you're at higher risk, all those kind of things, and also contraception if you're at that age, or pre-pregnancy planning, or any of those things. So we're going to talk about screening versus diagnostic testing. So when we're talking about screening mammograms, what that is we're casting a big net, basically. And we know that the risk for breast cancer overall is fairly high in the community. And so that's why it's recommended that all women do get screened for breast cancer at a certain age. And so that means that everybody should be getting their mammograms, not just the women who have family history or have a lump or something like that. So that's what screening is. Basically, this just applies to everyone. And then different organizations are going to have different criteria, and I'm going to really kind of go specifically into each one. And then what are we talking about when we're talking about screening? Well, for the sake of this lecture, really, I'm going to be talking about mammograms. So there's no such thing as a screening breast MRI or a screening ultrasound. Usually those are used for diagnosis. And so diagnostic testing, what that is if you feel a lump. in your breasts, if you have any breast changes, if your breasts are uneven, if you have nipple discharge, skin changes on the breast, anything like that, your doctor might say, hey, we need more than just a mammogram. We need to order a breast ultrasound as well, or maybe an MRI, depending what those risk factors or symptoms are. So breast cancer screening. So which kind of organization says what? And there's some other organizations, but really these are the top three that I would say have something to say about breast cancer screening. So the U.S. Preventative Task Force is an organization that a lot of physicians go by, especially internal medicine, family medicine, and even OBGYN. And they recommend basically every other year screening from starting at age 50. And so this is kind of where it gets a little bit confusing. So they say start at age 50 and just get it once every 2 years, get your mammogram. Now, the American College of Obstetrics and Gynecology says that you should actually start at age 40, and you should get your mammogram. You can get it every year if you want, but you should get it at least every 1 to 2 years. And also that you should get a clinical breast exam. And for the American Cancer Society, they break it down a little bit more specifically, saying that women ages 40 through 44 have the option to start screening with a mammogram every year, but really starting at age 45, women should get their mammogram every year. And then after 55, every other year. And so that's kind of because of just where the most breast cancers are going to be diagnosed is kind of through that 45 through 54 age. And so that's why the American Cancer Society has made those guidelines like that, which is a little bit confusing for everybody, including physicians like myself. So for me, I also teach residents and medical students. I have to explain all of this to them as well, and then also explain it to the patients, so that way I can make sure that they're getting their best option. And I don't normally explain it like I'm explaining this right now. What I tell patients is that there's some organizations that recommend starting at 40, 45, and 50. It's based on what you feel comfortable with. And, if you have any family history, I recommend starting younger. If you have any symptoms, that's going to change things as well, because we're not screening at that point. We're looking for that diagnosis, basically. So I kind of just counsel women as far as these are your options that are there. And actually, the insurance companies pay for it starting at age 40. So there's no there will be no like extra cost incurred. The other thing is, so why don't they all say start at 40? So they all don't agree at the age of 40, because between the ages of 40 and 50, there's an increased risk of what we call false positives. So meaning that we're going to find there's something going to be seen on that mammogram, but it's not going to be a breast cancer. And that woman is going to probably have to endure a breast biopsy and maybe some other invasive testing, and maybe even a removal of the whole breast or a lump. And at the end of the day, it was all for nothing. And so that's why the different organizations have different timelines, because the U.S. Preventive Task Force has said, hey, there's just too many false positives between the ages of 40 and 50. So we're not going to screen everyone because of that. And we're not going to, make women get more breast biopsies and these other procedures that could, damage them and create undue anxiety. So it's not very straightforward for anybody. So what is a mammogram? So a mammogram basically, the woman will basically have to completely undress just from the top. They may give you like a paper gown versus like a cloth gown, or if you maybe have just a button shirt and remove the bra, you may be able to just do that depending on the imaging facility. And basically it's a specialized X-ray. And so these plastic shields actually squish the breast tissue as flat as they can. Basically, women say it like it's like a pancake. And it is pretty uncomfortable from what women have told me. I haven't had to have a mammogram yet.
Yes, it is uncomfortable.
But and I have spent time with technicians to actually see the procedure itself, and it looks extremely uncomfortable. And usually the women who find it most uncomfortable are women with very large breast tissue, because they have to keep redoing the image sometimes, and then also women with very small breast as well. So so that is just to kind of show you a picture of what is actually involved there. There may be some women who cannot get a mammogram. So I had a patient the other day, she actually had a triple bypass of her heart, and she's at an increased risk for breast cancer. So she really needs to be doing her yearly mammograms. But because she's had surgery in the midline of her chest going down, and she has a huge scar, she's not able to get a mammogram, because it like pulls at her chest wall, and because of the pain and just the location of the scar and everything, she's not able to get it. And so for the past 5 years, she hasn't gotten any imaging of her breast, because nobody referred her for anything else, which is definitely what was not appropriate. She should have been offered some other option. So the other option, mammogram or MRI. So there's a lot of billboards right now saying we can do breast MRI. Breast MRI is like the new thing. A lot of women have been asking me for breast MRI. But I want to touch on this first, because it's been so, kind of publicized lately. It actually, none of those organizations say that we should be doing breast MRI for everybody. So when we're talking about that screening, that's really just for the mammogram, not for a breast MRI. So some women may need a breast MRI. So like the patient I was just telling you about, also women who are at very high risk for breast cancer, like maybe they have a maternal aunt and their mother both had breast cancer, we may get both. So we may do but we would always do a mammogram still, actually. And then there's basically just not enough evidence yet for the screening for using MRIs. Although what is nice about them is they don't squish your breast like a pancake. So some women, though, have claustrophobia, so meaning like they have to go in that tunnel basically for the MRI, and some women aren't able to tolerate that. So there's plus or minus on both sides for how the imaging is done. And then the MRIs actually have a higher risk for false positives, which, like I said, those false positives can lead to unnecessary biopsies. And they're actually a lot more expensive overall to the healthcare system. And when you're thinking about expensive, well, you're like, well, I have insurance. Well, when we're talking about what we should recommend everybody to do in order to detect cancer, maybe it's not cost effective for everybody to do this when another test is just as good or maybe better. And so, like I said, the mammogram is for average risk and even high risk women as well. It uses the X-ray technology. We talked about pain. And then for women, if anybody's been ever told they have very dense breast tissue, meaning that basically the tissue is less fatty and more like fibers, like it's very thick. Those women will have more false positives from their mammograms, or false negatives, meaning we can miss some breast cancers as well, because they pop up as the fibrous tissue pops up very white, and the breast cancer can also is white on exam. And so other women that may have false positives are younger women. So not every 24-year-old that comes in the office, I don't order a mammogram on everybody that comes in that complains of breast pain, because we know that there's a higher incidence of false positives. So that's why seeing the doctor and kind of having your doctor take a really complete history of what's going on, because there's other reasons for breast pain and discomfort other than just breast cancer. So obviously we want to be careful and not miss anything too. And then also women who take estrogen are at higher risk. it may have more false positives on their mammograms. And then if they have a family history of breast cancer, because that radiologist, the person who looks at the images, knows the history beforehand and is really probably being a little bit hyper vigilant if they see anything on a mammogram. So genetic testing. So another popular thing that I've been asked about lately is genetic testing. I'm just going to take a sip of my water here. So for the genetic testing, it can be a blood test or a saliva test. Now, this is not, what is that, 23 DNA and me thing or whatever, like that swab you can get at home and you get all this genetic results back. This is, done by a genetic counselor, because those self DNA tests that you can buy from Amazon, they only have a couple of these genes or mutations. So what we're looking for breast cancer is called the BRCA gene. And there's BRCA1 and BRCA2. And these are cancer suppressive genes that everybody has. But the problem is some women can have a mutated gene, and that gene that's mutated can keep being passed on from generation to generation. And these can lead to breast cancer. And pretty significant percentage of breast cancer. So we know that women with a BRCA mutation have 45 to 85% risk of breast cancer by age 70. So these women are, like I was saying, these high risk groups. Now, 90% of the women that that say they have a family history of breast cancer have no idea if their mom, aunt, sister was tested for BRCA. And so if you have somebody in your family with breast cancer or know somebody in your family, it is really important to ask them, were you tested for BRCA? Do you know if you have the gene mutation for BRCA? Because that really affects the whole family. And not just for breast cancer, but actually it affects it for ovarian cancer and some other cancers as well, like pancreatic cancer. So we really want, everybody that should be tested for the gene to be tested. Now, if everybody could be tested for all these genes, that would be great, but the genetic testing is actually really, really expensive. And so, we actually have to send patients to genetic counselors for them to order these tests, because they're going to get a whole slew of results back. And they're the only physicians really who are very specially trained on how to read this results back. So don't buy your own genetic test for breast cancer for screening. That's one of my caveats there. Any questions about the genetic screening part, if anybody wants to say anything, because it is a little bit confusing. Yes. Zane, unmute your mic.
If you end up getting tested and you have, is it BRCA? Am I saying that right?
Yes.
And you have a BRCA mutation, did you say you have a higher risk of not only breast cancer, but other types of cancer too?
Yes. So, so the ovarian cancer, fallopian tube cancer, pancreatic cancer. We thought that colon cancer was one of those, but now we're finding out that it's probably not really correlated with the BRCA gene. And those are the ones that I know of, and there may be others as well. So
I have a question as well. Yeah. Like if because I had my BRCA test done when I was first diagnosed and they came back negative, mine came back negative, could my daughters be positive? Like how does that
yes, so
can I still pass it on to
them? Because your husband could have the gene, which could be passed to the daughters. It's unlikely though that that your daughters would have the BRCA gene, especially after you were tested, but it is a possibility. And I don't know what the risk of, like, any family risk of breast cancer puts your daughters at higher risk in general, but I don't know exactly what their risk would be if you had a non-BRCA related breast cancer.
Okay.
So the other thing about the screening is that completely changes when you have a family history of breast cancer. So then it goes on based on what your mom's age was when she got breast cancer, and all that takes a factor into when you should be screened. So that's why it's really important to get, a full family history, because once we find out there's a breast cancer, ovarian cancer, pancreatic cancer, we ask, well, what age were they diagnosed? Okay, well, did they get this genetic testing? So, we go into more specific questions. So sometimes, most patients just really don't know this detailed information, and then we just have to use our best guess on what is the appropriate screening things that they should be doing at that point. Do they, are they going to qualify for the genetic testing? Is the insurance going to approve it based on what the information that we know? So, so how can we decrease our risk in general of breast cancer, and really some of the things for any cancer? So self-breast awareness is what all of the societies recommend, and I'll talk a little bit more about what that is. Eating a healthy diet, of course, so fruits and vegetables, and especially plant-based proteins. So more and more of the physician societies are finding out that animal-based products have a lot to do with cancer and genetic mutations. And so, and developing diabetes and heart disease and all those other things. So if we can lean more towards those plant-based proteins, that's ideal. And exercise. So exercise, of course, for everything, at least 150 minutes of moderate exercise a week. So that's, 30 minutes, 5 days a week, or 75 minutes of intense exercise per week. History of breastfeeding is protective, so that decreases your risk. Although, even though that decreases the risk, if you're going to have a breast cancer, sometimes you're going to have a breast cancer. There's nothing, some women who eat a healthy diet and exercise and breastfed and don't smoke, self-breast awareness, did all the right things, and may still, develop breast cancer, especially based on a genetic component or something. And then just getting your cancer screening tests as recommended by your doctor. So, and if you have questions, being sure to follow up with them, saying, oh, my aunt just was diagnosed and, she's 50, or, following up with that. So self-breast awareness. So basically, we just want women to know their breasts. They don't have to do what we would do, like a full breast exam on palpating the breast, and but really just, knowing the size and shape of your breast, knowing what the skin looks like, noting if there's any discharge or leaking come from the breast, that's abnormal. Like if you weren't breastfeeding and then all of a sudden you start having, red nipple discharge, that would not be normal. So just kind of, knowing your breast and taking a look at them basically once a month, and then, feeling for anything new basically. So like I said, you don't have to go crazy with the feeling, but just kind of that if you're doing this every month, you're going to notice any significant changes. And so breast cancer actually is often found by women. So that's why this Know Your Breast campaign kind of came out. 50% of cases in women over 50, the women found themselves, and 70% of cases in women younger than 50. And so when a woman comes in and tells me she has a lump, even though she's 24, I'm definitely going to take my time and really examine that and see, if this is something that feels normal or this is something that feels really abnormal. Because like I said, women, are the best finders there, and talking to your doctor. And these are just some resources these are all the different societies I was talking about. And then the Susan G. Komen organization, who their whole website is dedicated to really breast cancer and any questions that women may have, and resources and hotlines and everything. So thank you all. Any other questions?
I had a question.
Yes.
Back to the genetic testing, is it possible, have you ever heard of someone being tested negative for the BRCA genes and then like maybe a few at their next screening that it was tested positive? Has that ever occurred?
In medicine, we never say never, basically.
Yeah.
So I don't know of any personally that's where that's happened, because the genetic testing has gotten so much better and more accurate, and it's really very sensitive. So like I said, for me, I don't the only reason I perform genetic testing is for my pregnant women, to see if they're carriers or if the baby has a genetic malformation. And the test that I use is 99% sensitive and specific, meaning that we're getting all of the negatives really and all of the positives. And so I would say, I think that's the BRCA testing as well is probably around the same, 99%. I guess there's always that really slight chance of error there. So,
Okay. Thank you.
Yes.
Dominique, I have a question. So what are the recommendations on screening for women with a first-degree relative positive family history?
Okay. So there's actually an app that I use too, and I forgot to mention it. So it's called BR Risk, basically Breast Cancer Risk Assessment Application. And what I do is, if a woman, so she tells me she's a first degree relative, and then you have to put in the patient's age as well as the age that the first degree relative developed breast cancer. And that will determine the patient's risk based on in 10 years, in 20 years, in 30 years, what their risk is for developing cancer. So some women do not want to get genetic testing, or they can't afford to, or whatever reason. I usually, if they have a first degree relative, I automatically give them that option. You don't know what your mom, if she had BRCA or not, I would suggest that you would be tested. So I automatically for women recommend they be tested for at least for BRCA. And then
what about the mammogram screening?
And then the mammogram screening, again, it's based on the age that the first degree relative had developed breast cancer. So say they were, like say it was a mom and she actually got breast cancer at 35. So then we would screen the daughter at a much younger age because of that very increased risk. Does that make sense?
Yeah, I asked, of course, I wear pink for my mom. So she was 47 and premenopausal when she was diagnosed with breast cancer, stage 4. So I started screening at 35.
Okay.
Yeah, I started screening at 35, and then I get mammograms, and you were explaining that you've never had one, and it's really not bad. You don't wear your deodorant and stuff, and you go in, and it's pretty quick and painless in my opinion. A little uncomfortable, but not too bad. But and I've been going in for mammograms every 2 years. My mom was not genetically tested, and I have not been genetically tested myself. But I do go in for my mammograms, and I go every 2 years now because I've always had normal mammograms.
Okay, and that's based on because you were young, you were in that category as well. So it's usually 10 years less than the age that the person was diagnosed, like the family member was diagnosed. So, I would say, I would have said probably 37, but, 35, like it's not an exact science. So, yeah. But yeah, and then from there, I probably would have done the 2-year screening as well until you were 40. And then once you turn 40, go every year from that point.
So if I was what, I think 41, that means my daughters should start getting mammograms at around 31.
30, yeah.
Oh, wow. Okay.
Yeah. And again, they probably wouldn't need to, do the mammograms as well every year. They would probably go every other year based on what was seen on that initial mammogram. So, and based on, if somebody on their father's side had breast cancer or something like that. So everything, we look at all of those factors to kind of score what the risk is.
Okay. Got it.
Yes.
Thank you.
What if you have a first degree relation with someone who was diagnosed with it at a later age? And the 10 years before, like for example, my mom, she was diagnosed at 59. So should I wait till 49 or just wait till I hit 40? Or should I have done it by now?
And that's where I that's probably the most common question. And I'm a little bit more of going.
I've heard a lot of different stories about when, how, or maybe just not yet. Wait till 40. But
right.
It was your mom, so maybe do it before that.
Right. Because she got it at a later age, definitely you wouldn't have to start until, earlier than 40 definitely wouldn't be recommended. But I would probably lean on this side. I tend to go with ACOG, the American College of Obstetrics and Gynecology anyway, because I also take care of pregnant women, and that's my college, my organization that I go with as well. And so I would definitely recommend, I would say if you were me, if you were my sister, I would recommend starting at age 40 for the screening. And then, like I said, you could probably do the every 2 years if you wanted to, even from 40 to 45 or 40 to 50, and then do the every year from at least 50 to 55. So.
Okay, thanks.
I had a question too.
Yes.
So I had it at 36. So that means my kids would go at like 25, 26. Is that good for them, or is
it actually changes a little bit if it's that early onset? And again, it goes into that if you had the genetic testing as well, to see, and then how many people are components. But I'd have to look it up, but I think it would actually be starting at age 30 still. Unless they had symptoms or something like that, then they would go ahead, they would be, again, this would be diagnostic mammogram if they had symptoms or something. So, but I'm pretty sure it changes and it goes to age 30. But like I said, for that one, it's a little bit different because that's so young. So I'd have to look it up.
okay? Thank you.
You're welcome.
And I have another question.
Mhm.
So my gynecologist would check my breasts,
Mhm.
and that she was the one who found it. Like, it didn't come up in the mammogram. It was something she felt. So that's just something that I feel like, when does that usually start, or can you ask your doctor for that?
Yeah. So ACOG says basically at the well woman exam. So, you get your pap smear and you get your breast exam. And so pap smears used to start basically whenever women were sexually active. So even like 16, I still do breast exams even for my adolescent patients. So, my 12 through, I was taught to always do a breast exam. That has shifted a lot. I've seen this shift happen where the other organizations are not recommending physicians to do breast exams, and the doctors who do not want to do breast exams are not doing them. And so it's a little bit disturbing to me that your doctor wouldn't examine this part of your body that, like if it was a man, they're still going to examine that part. And so I'm of the belief, I teach the residents, like, just do the exam. Like, I expect you to do it. Whatever you do outside of here is your own beliefs, but these are the guidelines, and these are, the things we should be. And like I said, these are all guidelines. So at the end of the day, it is the physician's choice, but hopefully they're using all of these organizations to make a good informed clinical decision with their experiences and other knowledge. So,
because those can be then, my girls, should be getting that done. anyways,
Yeah.
and that's a type of a screening before they start with their mammograms at 35
Yes.
or whatever.
Yes, absolutely. Yes. Pretty much any woman in my office, if
Yeah.
she's there for a physical, she's going to get a breast exam. So
Thank you.
you're welcome. Anything?
I had heard something about coffee and tea not being risk factors. Is that related at all?
Yes. So
how is that?
they're not risk factors for breast cancer, but they are risk factors for benign breast conditions such as cyst and fibrocystic breast types. So some women may get pain if they drink more caffeine and like coffee and teas. And so obviously pain is concerning there. And so that's where that kind of plays in, but it doesn't increase your
How much
overall.
caffeine is too much? That's the question, right?
Like we have a nutrition expert down here too that can help with that.
Okay, good.
How much caffeine? That's a good question.
I mean, really, 400 milligrams is the cutoff I give to pregnant women, and I kind of give that to everybody.
Wait, so what is 400 like how many cups is that?
It's really like 2 cups of coffee.
One
Okay.
cup of coffee, it's like 150, I think.
Yeah.
Maybe 200.
It depends. It's your coffee you drink to Starbucks versus, Folgers Home or Dunkin',
Got it.
So
Thank you.
that caffeine is a really good question. I get that one a lot, actually.
Before we break for Maghrib, Farzana, I was thinking maybe if anybody's able to turn on your cameras just for a minute and we'll take a quick picture and then we can do our Maghrib break because I always forget to take a picture. If you guys are able to. Oh, where do I go?
Oh, I had to open the light.
There you are. Okay. Okay, on your marks, get set. Oh, there's Zainab. I see you. Okay, smile. Got it. Thank you, guys. What time
Should we
is
just
7
stay
o'clock?
logged on and just like mute
Yeah.
and shut off our cameras, go to namaz and come back?
Exactly. Yeah. So we'll just take like a quick 10-minute break. Everybody you can stay logged on. Exactly. Just mute and turn your cameras off if you want, and we'll be back in 10 minutes. Come back because we have more games and we have some other stuff too.